Good evening, everybody. We are live. It's now 7 o'clock. Welcome to all members of this meeting of the Audit Risk Committee. Welcome to officers, external audit, and anyone listening in via the online webcast. Can I please remind members after speaking, we have a new audio system. Please turn off your microphone for the benefit of those watching on the online webcast. If you leave it on, it won't work properly. So, thank you, Tom. Item number 1, apologies. Do we have any apologies?
Thank you, Chair. We've received apologies from Councillor Lambert, for whom Councillor Chatfield is substituting, and Councillor West has given us notice she may be up to 10 minutes late.
Thank you. Just to let you know, I have no internet, so I'm working a bit blind this evening. So excuse me if I have to rely on Tom quite a lot. Number 3, declarations of interest. Members are invited to declare any disclosable interests under the Code of Conduct and the nature of those interests in respect of the items on this agenda and or indicate if Section 106 of the Local Government Finance Act 1992 applies to them. Are there any declarations of interest this evening? No, thank you. Number 4, petitions, deputations and... Sorry. Oh, sorry. Item 2, sorry, I beg your pardon. It's not even, it's on my piece of paper, not my PC. To confirm the minutes of the Audit and Risk Committee held on the 5th of December 2023, I will propose approval of those minutes from the Chair. Do I have a seconder, please? Thank you, Councillor Payne. All those in agreement?
Thank you, Chair.
Thank you, and 1 abstention. There were 3 actions arising. Action number 1 was for Kirsty, and I believe that's covered off under item 8 on the agenda. Action number 2, Councillor Johnson, I think that was with you. If you could provide a verbal update, that would be excellent.
Yes, it was, Chair.
Thank you.
So what I've done is I've written to all cabinet members separately. I've separated out the actions by portfolio holder. So it's easy to digest, and I've requested that they take this up with the relevant director, and they've confirmed to me that they will be doing so. And I've copied Rachel on that email.
Thank you. So that was in respect of long outstanding actions on the audit report. Thank you. The 3rd item was for David to organise a self-assessment meeting, which we did have. Rachel sent me the results of that today. They were actually very good. And Rachel did confirm earlier that it's the best one she's had. So, Rachel, do you want to add anything to that?
Thank you, Chair. Yes, so I have conducted the self-assessment with a number of local authorities audit committees. So it's always interesting to see what comes out of it, and it is a good score. It does show a good level of compliance with the expected standards. And I think where there are some gaps, we've talked that through as a group, and I think some of them you are aware of the gaps, and almost it's been a conscious decision to not actually apply that approach. For example, not having an independent member on the committee at the moment. So yes, I think hopefully that's been a useful exercise to go through.
Thank you, and I think we're going to include that in the annual report as well, aren't we? Thank you. Sorry about the disruption to the agenda. Sorry, Councillor Powell.
That's okay. Could I just check? Obviously, didn't take part in that self-assessment because I was away. Are there any particular training issues that have been pulled out of that we're going to take forward?
What I'll do is append the assessment to the minutes, so you can have a look at it if that's okay with you. Yeah. So item number 4, petitions, deputations and questions, to receive them from members and of the public in accordance with the provisions of the procedure rules 93 and 94. Do we have any to come in tonight?
None received, Chair.
Thank you. Item 5, questions with notices from members. Any questions received from members of the council in accordance with provisions for procedure rule 95? Do we have any of those?
None received, Chair.
Thank you. Notice of motion submitted under procedure rule 97?
None received, Chair.
Thank you. Item number 7 is a highways progress report. Penny was due to attend, but unfortunately has a conflicting appointment this evening. We didn't actually receive a written update from her until fairly late this evening. What I'm suggesting is that this update will be appended to the minutes, and if you have any questions, could they please be directed back through Democratic Services, and Tom will ensure that they're asked of Penny afterwards. Councillor Stevenson.
Is that possible to have it put on the next audit and risk agenda, because I think it is of high public interest and this is a public meeting and it is important that we can, it's not email traffic, that it's in public.
I think that's a good idea because we'll actually be in a new contract implementation at that time as well. So yes, if we, committee members, all in favour? Yeah, thank you.
Chair, that's carried.
Thank you. Item 8, progress update report for the implementation of internal audit recommendations. This is a report 47/2024 from Strategic Director of Resources, and Kirsty is going to present the report and take any questions. Thank you. The recommendation is to consider and gain assurance to the progress of the completion of recommendations made by internal audit. Thank you, Kirsty.
Thank you, Chair. So, as alluded to in the minutes considered earlier tonight, this follows on from the request to look at and gain assurance on the 2 outstanding internal audit recommendations, which were outstanding for a period of time and also high as in terms of the risks that internal audit had identified those as. So the report in front of you provides that update, provides some background as to the timing with regards to the report and its findings at a high level, and also some background with regards to the properties function being within places and the recent transfer to my responsibility as director. And also there has been a change in the head of property as well to provide that context between then and now. In the there is an appendix table to the report that provides the recommendation and what actions have been taken and are being taken and the timescales that we're working to. So by the end of April, all of the recommendations will have been implemented in full. And I will stop there.
Thank you, Kirsty. Committee, any questions of Kirsty, please? I just have one, Kirsty. Does the amount of money, the 10k, include all the work for the asset management site schedule and supplier info? The whole package? Okay.
Yeah.
Okay, thank you. Anything else from the committee? No? Okay, please could I have a proposer and seconder to approve the recommendations? Councillor Stevenson, Councillor Payne, all those in favour?
That's unanimous, Chair.
Thank you. Next we move on to item 9, which is the internal audit progress update to receive report 48/2024 from the Chief Internal Auditor. Rachel will present the report and take any questions. We also have Kim, who's the Director of Adult Services and Health, just help us with a recent audit that will come up in the report. Thank you, Kim, for coming along tonight. The recommendation is that the committee notes the internal audit update report in Appendix A. Thank you.
Thank you, Chair. So just to take the committee briefly through the report. So this is our usual progress update on the delivery of the current year's internal audit plan. So firstly, if we turn to table 1 on page 24 and 25 of your papers this evening, this provides a copy of the internal audit plan, listing all of the assignments, the status as at the time of producing this report, and the outcome of those which have been completed as at the time of reporting. I can confirm for the committee that further progress has been made. Obviously, there's always a time lapse with these things. So a number of the reports that were at draft report stages at the time of producing this have since been finalised. We've also had some further audits have since been completed. So I remain on track in terms of the delivery of the audit plan, and all of the audits that are finalised after this meeting will be summarised for you in full in the annual internal audit report, which comes to the next meeting. So you will receive all of those outcomes. So between the period of the last audit and risk committee and producing the papers for this committee, we had finalised a number of further reports in relation to information governance, early years providers and continuing healthcare funding. Two of those, unfortunately, have received assurance opinions of less than moderate assurance, so limited assurance, and one in relation to the control environment design, which was in relation to the continuing healthcare funding, and the other was information governance, which received a limited assurance on the compliance element. So slightly different types of assurance, but as those are both below moderate, we just highlight those for the committee's attention. And as the chair's mentioned, Kim's here tonight if the committee does have any questions around that report on the continuing healthcare funding audit. We've also, in each of the columns obviously at the end, given the organisational impact of those as well, considering the risks associated with the findings. So those will obviously need to be considered when developing my internal audit report and opinion for 23-24. But we will, of course, take into consideration any actions taken between the issuing of the report and the time when I produce that assurance opinion, if we're able to take assurance from any actions that have already been taken. Also within the report, as we've already heard this evening, is an update on the overdue audit recommendations. So I'm conscious on page 29 in Appendix B, there is a table that sets out the implementation rate since the last meeting. So we've had 18 actions which have been marked as implemented and closed, and 29 which remained open and were overdue for implementation. So we had one that fell into that category of being high priority and over 3 months overdue, which you have actually received a further update on in the earlier agenda item, so I won't go into that in detail in Appendix C. On page 30 is the latest update we had as at the time of producing this report, which I appreciate you've got a further update in the earlier agenda item. So overall, I'm happy to give the committee assurance that we are on track, as I say, in terms of the delivery of the plan, and I'm happy to take questions on any of the detail within the report. Thank you.
I wonder, Kim, if you would like to just give us a quick overview of where we are in continuing healthcare audit and the focus on the remedial actions. Thank you.
Thank you, Chair. Thank you for inviting me. I'm pleased to be here today to be able to talk about it. Can I say this was as I started my interim job a year ago, this was one of the first requests that I had that I spoke to Kirsty about, Strategic Director for Resources, of my concern around the CHC process within Rutland County Council. I had a lot of staff working many hours around the CQC process and trying to unpick the information but we didn't have a process in place. So I welcome this audit and I welcome the outcomes that have come from it, because they are things I recognise within the service. So immediately we have started to put in some changes. We have now got full ownership of that under my service. Adult Social Care, our head of service, will take the ownership for that. The standing operating procedures, I've already started. I've asked my head of service to start work on that, and they've had a meeting with resources and other colleagues in the council. They've had a first meeting to start to draft that and bring in those recommendations into that operating procedure. We'll also have started through the PSW and the Quality Assurance team some immediate work around practice for social workers on inputting on liquid logic and case work and how that is recorded. So it gives us the details that we then look at to then follow that process and then talk to the ICB. The risk remains in this, really. All of this is very doable. The risk remains with the ICB in who we contact. That was always a difficulty. We would try different people, get moved around. We couldn't get answers from. So for example, if continuing healthcare has been agreed jointly, then that should be the agreement. But sometimes the health didn't always say that was the agreement or went back on that decision. And it was then also around fee uplift. So if we'd had a fee uplift and they didn't agree with it, then we had difficulties in conversations there. So we have to, with this process, what I want to do now is take that back to the ICB and say, look, this is our standing operating procedure. What does yours look like? How's it being applied? And can we start to work together to ensure that this process is more streamlined? It hasn't been. So I do welcome this as a good piece of work that we can really start to drive that forward. I work closely with the ICB lead, Deborah Mitchell, so I will be putting this as a piece of priority work with her over the next year, particularly around that risk of how that interaction between us and ICB continue to move forward.
Thank you, Kim. Committee, any questions for Kim? Councillor Payne.
I must admit, I'm a little bit surprised to hear that things were not always not well. It gives you're giving the impression that the structures and procedures that you inherited were weak. Would that be a fair characterisation?
No, not at all. I think it was just a case of it hadn't been audited for a while, so we hadn't got that oversight. So and I can assure you that the income hadn't changed on that. So if you look at our continuing healthcare and our income from continuing healthcare, it is good. So we've done some audits to actually look at that and say, well, actually, have we received less income, or the application of the framework hasn't been as good? That is not the case, because what was in place before I came in was in-reach nurses as part of the hospital team. A lot of the hospital work is around the continuing healthcare work, and because Rutland has the in-reach nurses in place, we actually do very well for continuing healthcare, better than say Leicestershire or Leicester City, because we have those posts in place. So we do receive good income from continuing healthcare. It's just that internal, we just need to solidify that process. So it wasn't about there was weakness, it was just about making sure that the processes were in place.
But also, from what you're saying, the difficulties arise between two different organisations with what sounded like very different structures. I've come across that many times in my professional life, and that the danger for that is that the clients are the ones that end up falling through the grate. And when you were speaking earlier, I had memories of other conversations I had. But you're confident that the procedures now are more robust. Would that be fair?
The procedures are robust, and the people. This is a lot of back office work. The people, we make sure that it doesn't affect their care and support, or that they only have to be included if they need to. So what it affects is just that back office about us getting that money back from the health service.
Kirsty.
To further emphasise, but I don't think it's needed as an emphasis, but the conversation that Kim and I had on my arrival as well, so 2 new directors to the council, I'm looking at our balance sheet, the council's balance sheet, looking at the debtors amount, so how much and where are the people that owe us money, or organisations that owe us money. Past experience had told me this was an area worth investigating, and that prompted the conversations with Kim. So as you can imagine, in terms of debt collection, the older it is, the harder that debt tends to be, the less corporate memory there is, and hence the risk that can be there just through that collection of debt. And so that's what where Kim and I and with Rachel thought there was management action there and internal audit to help look at the processes, look at recommendations for improvement for that income collection.
In other words, get it quick or don't get it at all.
Councillor Stevenson.
And I think with all of that, what's really reassuring is the self-awareness. You know, it wasn't a case of Rachel saying, oh, I think we should look at this. Oh, actually, there's a problem with the process. It's actually saying, right, how can we use audit to support us where we know that there is a process issue? And more importantly, if you've got an external partner, then there's a really robust set of evidence that the circle has been squared. So I think that's really encouraging, Chair.
Thank you. Committee, any more comments? Thank you for coming in, Kim. And I think it seems a good piece of teamwork to me that everybody's working well together to achieve a common goal. So thanks for that. And committee, I'd like you to just... Oh, any more questions? Sorry. Councillor West, I'm sorry, but you can't vote on this one, but you can on the next one.
I'll speak. Like, you've got my sympathy because we haven't had an in-person audit. Sorry, we haven't had an in-person audit for 4 years since COVID, and procedures do slip a little bit when you haven't quite got that oversight. And we've got one for the first time this year, and our procedures have improved a bit in readiness for an in-person audit.
Okay, thank you. Please could I have a proposer and a seconder to approve the recommendations? Sorry, Councillor Payne and Councillor Stevenson. All those in favour?
Unanimous from those that can vote, Chair.
Thank you. And Kim, if you want to leave us, that you don't need to stay. Thank you. Okay, thanks for that. Right, so item 10 on the agenda is the Internal Audit Plan 24-25 and the Internal Audit Charter and Strategy to be received from the Chief Internal Auditor, report number 49/2024. So Rachel will present the report and take any questions. The recommendations are that the committee approve the Internal Audit Plan for 2024-25 at Appendix A. Number 2, approve the Internal Audit Charter and Strategy at Appendix B. And number 3, approve the delegated authority for the Strategic Director of Resources in consultation with the Chair of Audit and Risk Committee to agree amendments to the plan during the financial year if required. Thank you, Rachel.
Thank you, Chair. So, as you said, this is the Internal Audit Plan for 2024-25. So, in line with the Public Sector Internal Audit Standards, I need to bring the audit plan, which essentially is our proposed schedule of work for the next 12 months, to this committee for your review and approval before we make a start on the 1st of April. So I brought a paper to the committee towards the end of the last calendar year on the process that I would be following to develop your draft internal audit plan. So that's the process that we have followed to make sure that we have a risk-based, value-adding internal audit plan to bring to you today. So essentially, I've worked with the council senior management. I've looked through risk registers and the corporate objectives, looked at recent audit coverage and any other sources of assurance that we're able to place reliance upon, and tried to then develop a risk-based approach and present to you a potential plan that gives us some assurance on those key risk areas and is areas where we can add some value as an audit service. So the draft audit plan is provided from page 41 of the papers today in table 1. The start of the document sets out and details some of the process that we followed in developing the plan. And then within the plan itself, in table 1, we've set out what the audit assignment is proposed to be, including some information about why it's on the plan and also what we're looking to get from it in terms of assurances. Then I've referenced the risks in terms of your risk register where appropriate and given you an indication of the likely timing and budget for each of those audits as well. So I don't intend to go line by line through all of the audits, but I'm more than happy to take questions from the committee on any of the content as to why it's there or what we would hope to get from that audit review. But just to draw a couple of particular areas to the committee's attention, just for information. So we've talked already tonight about the continuing healthcare funding audit that was delivered in the current financial year's audit plan. So we've included a follow-up review on that in next year's audit plan, which is included on page 42 of the papers. So that's a follow-up review, which hopefully we'll be able to report back to the committee on the progress that's been made and give you an updated assurance opinion in relation to those processes. But also to note on page 41, there's another reference to continuing healthcare funding, because on the basis of the findings of this audit, we think it may also be of value to look at children's services, because this is actually subject to a different set of processes, albeit similar. There are some differences. So given what we found in adults, we think it would be useful to also conduct a review on children's and see what assurances we're able to give on those processes as well. We've also included a review on information governance, again, another area that received limited assurance in the current year, so we've included that next year to follow up on progress that's been made. Just some other areas that may be of the committee's particular attention. We've included further days in the audit plan for the Levelling Up Fund programme, with that being a key area of focus for the council. I think that's something we need to continue to give assurance on. We have now finalised our phase 1 piece of work, which will come to the next committee meeting. It was finalised, unfortunately, just after the papers were produced, which has given that initial assurance over the governance and financial management framework for the programme. But next year, I'd expect us to be drilling more into the actual project management, looking into some more Rutland-specific work, and giving you some assurance around how that's being delivered. There are also some areas that were specifically highlighted by members of the Audit Committee when I consulted with you at the end of the last calendar year, including flood authority statutory duties, which is included on the plan, and also an initial review of the new highways maintenance contract as well. So hopefully it's a reassurance that those have made it onto the plan as requested. So as I say, I'm happy to talk through any of the other areas that are included on the plan if members have any questions. But also to note, there is a table 2 on page 44 of the papers, and this is a reserve list. So this is essentially areas that also came out of that audit planning process, but following a risk assessment didn't quite make the cut onto the audit plan today. But we can reconsider these if anything was to change during the year, and we need to reprioritise any of those areas. That's something we could look to amend if we needed to. And I've also made comments in there as to how we would seek to get those assurances if we do not cover the audit in this year, most of which would be to include it in the next year's audit plan. But we may, as I say, be able to find scope to review that if there are any other changes in the wider plan as well. So that's a brief overview of the plan. The other part of the paper this evening is the Internal Audit Charter and Strategy, which starts from page 45 of the papers. Now, this is another document I bring to this committee on an annual basis, and it essentially sets out how we deliver your internal audit service, the mission of the internal audit service, how we comply with the standards, and how we interact with the committee as well as senior management. So we review this annually, so it has had a full review, and members of the committee may recall when I brought this to the committee this time last year, we did make some amendments to the assurance ratings at that point and some of the definitions around the assurance opinions. Following the review this year, I'm not actually proposing any further changes to the document, so it is the same document that you approved this time last year. Again, I'm more than happy to take any questions on any of the content, but I'm not proposing any changes. So essentially, we will continue to deliver the internal audit service as we have during 23-24. So those are the two main things I needed to bring to the committee's attention within this report. As mentioned, there is also a recommendation around a delegation to the Section 151 officer to approve any amendments to the audit plan during the financial year. This really just recognises that we do need to be proactive, risk aware as an authority, and if something does change in terms of the risk environment, we need to be able to amend the audit plan and react to that rather than waiting for the next audit and risk committee, which can be some time before we get to that meeting. So that enables us to make some changes and make a start on other work that we feel is a priority if that was to happen. But just to reassure the committee that if any such changes were approved outside of the meeting, they would be reported in full at the subsequent meeting of the committee for information. So hopefully that's a useful run through of the report, but I'm happy to take any questions, Chair. Thank you.
Thank you, Rachel. And just to confirm that the any changes to the plan are in conjunction with the chair of the Audit and Risk Committee as well. Yeah, which is what the recommendation says. Yeah. Councillor Powell.
Thank you, Rachel. Just one quick overall comment. Obviously, we've had a refreshed corporate plan, so presumably those headings will now be linked to the refreshed priorities. That's they'll still link in. And the other one on the things for future meetings, you've got asset transformation. I was just wondering what the thinking was behind that in view of there is going to be decisions made according to the forward plan on some of those initial stages of that, this year, 24-25. So I was wondering what your thinking was in terms of it, what you're going to look at in terms of that from an internal audit perspective that could be left until next year. Thank you.
Thank you, Rachel.
To you, Chair. Thank you. Yes, so just to confirm on that, so we did look into the timescales around this, which is one of the reasons I thought actually it may be better to wait until 25-26, because the decision-making process obviously needs to go ahead, as you say, in line with the milestones that we've set. So we would be looking to give assurance over the risk management of the delivery of the project and any transformation that was to go ahead. So it may be that we need to give that some time for it actually to be approved as to what's going to happen, and then we would look at some of those key stages in the actual project delivery. If that was to change and any of the delivery comes forward, we may need to, as I say, reprioritise some of these areas. But that's what we would be looking to focus on in terms of actual delivery and managing risks around that if that was to go ahead.
So if there are risks highlighted at an early stage of this process, I'm just concerned by the time you come to look at it, those decisions will have been taken and those risks will have been embraced, sort of thing. Does that make sense?
I wonder if there isn't a role for scrutiny in those. Scrutiny will play the role in those decisions and challenge those decisions. And then there's a role for audit and risk in terms of process afterwards. That's my understanding of it. I don't know what you think, Rachel, or anybody else.
Exactly, Chair. So as I say, I think the decision making needs to happen first, and as you say, that's where the scrutiny role comes in, is around the decisions. Once a decision's been made as to what's happening or the policy is set, we can then look at the delivery and the processes that follow on from that and managing the risks around the process. So hopefully that timing will, but as I say, we can keep that under review. If something was to come forward, we may need to reallocate that.
And if the committee want to bring it forward, then the committee has that discretion to do it, or the Section 1.5 officer with the chair of audit and risk at the time. So there is some flexibility. Sorry, Councillor Stevenson.
Yeah, just to underscore how important the asset transformation is, it's a linchpin in the fundamentals of how Rutland County Council operates and delivers service. So that sounds very logical to use scrutiny with that function and then the audit bit, because I think if we get this wrong, I don't need to say that it's an absolute whopper.
Totally agree. Any other comments from the committee? Thank you. In that case, do I have a proposer and a seconder, please? Councillor Stevenson, Councillor West, all those in favour?
Thank you. That's unanimous, Chair.
Sorry. Item 11 on the agenda is the annual governance statement. This is to receive report 5024 from Rachel again. Kirsty is going to present the report, though it says on my notes here, which is a bit of a contradiction. I'm assuming one of the two of you will. but the recommendations are, there are three. One, to note the arrangement for compiling, reporting on and signing the annual governance statement. 2, to review and comment on the annual government statement, including any areas which should be amended. So that's job for you committee. 3, subject to changes identified above, agree and approve the statement for signature by the Chief Executive and Leader of the Council for inclusion in the Statement of Accounts. Thank you, Rachel or Kirsty.
Thank you, Chair. I've got this task. And Andrew indeed has helped put this together as well. So you've got double trouble, as usual, with myself and Andrew. This report is brought here for Audit and Risk Committee as it forms part of the closure of the annual Statement of Accounts. And you'll notice that it is dated for the 22-23 financial year. So, and there's another paper later on, and indeed an update. This has to some degree been caught up with some of the delays within the system on audit as well. So if it feels out of kilter, it's because it is in terms of the standard way of how a council conducts business with regards to the statement of accounts. It's not a financial exercise, but one of a corporate overview of governance processes. So you're seeing 2.1.2. The report includes the annual governance statement for this committee to review, challenge and advise the leader and chief exec accordingly on its contents if needed. 2.1.5 also explains that this has been put together with regards to looking at the evidence of the governance arrangements in operation for the council for the period concerned. And by doing this, we demonstrate the compliance with the principles of good governance and highlights any actions where they're required with reference to Rachel's annual audit report. The title, Rachel, for 22-23 as well. So some historic of nature. So 2.1.6 provides a summary table of that report from Rachel that was provided, and also provides a comparison with the year before. That's one piece of our evidence in terms of good governance. We also have the external auditor's annual report for the council for 21-22, and again that's on the agenda item tonight as well, with the overview of the no risks of significant weaknesses, but there are some areas for recommendations for improvement. As you are aware, another area of evidence for good governance is our risk management approach, and again that's brought to this committee on a regular basis in terms of the strategic risk register. And finally, in 2.1.10, there is an overview of some of our governance setup and framework, which helps ensure good governance as well. Appendix A provides a pictorial view because there's a lot of information there, and how does it all link together. So there's a chart picture showing those good areas of corporate governance, and how the council's key documents and policies feed into that process, and also, for example, the key players within that. So, for example, internal, external audit, directors, heads of service, member assurance, for example. Appendix B is the actual document annual governance statement that we'd be looking for comment on, and also for the leader and the chief exec to approve as part of the final statement of accounts process for 22-23. Pause at that point.
Thank you, Kirsty. Committee, any comments, please? Councillor West.
Thanks, Chair. It's only a brief one. I noticed on this that under transparency, we publish on our website any expenditure over £500, which is quite a low threshold. Do we really publish all of that? So I mean, I confess I've never looked, but maybe I should. I don't know. I'm amazed that we publish that much data on the website.
Kirsty, thanks.
Yes, we do, and it's a requirement that we have to provide that information, so it's freely accessible, and there are various organisations that use that data to analyse our spend.
How often do we update that? Who's got the enviable job of...
Just to note, and Andrew can correct me, there's the responsibility, I believe, is to publish it quarterly, so it's no more than 3 months in arrears. Some councils do that quarterly, or they do it as a monthly process as well, so there is a range, but the requirement is at least every 3 months is on there.
Thank you. Committee, any more questions on the annual governance statement, or are we prepared to recommend this for approval by the Chief Exec and the leader? Yes. Right. Could I have a proposer and a seconder, please? Councillor West, Councillor Powell, all those in favour?
Thank you. That's unanimous, Chair.
Thank you. Item 12 on the agenda This is a report from Kirsty, report number 51 2024, Auditor's Annual Report on Rutland County Council 21-22 and 22-23. The recommendation is to consider the findings of the external audit report and resulting recommendations for improvement.
Thank you, Chair. And I've changed my partner this time to Laurelyn at the end, who can help with the Grant Thornton view of life and the recommendations being put forward, and our management responses as well. So by way of overview, again, it's linked to the Statement of Accounts process, and Grant Thornton, as part of their responsibilities, our external auditors are required to assess the council's council, that we have the procedures and practices in place to ensure catchily known as the proper arrangements for securing economy, effectiveness and efficiency. So the three E's, sometimes you may have heard of as well, and they've provided some recommendations for improvements in those areas as well. As mentioned, this is part of that process where there is recognition of the delay within the system of external audits, and therefore we have a combined report for 21-22 and 22-23. So that is slightly unusual to the standard way you might have expected to receive this information. The work was undertaken in the main during the summer, and has been published now, so to give you an idea of some of the timescales and context for where the recommendations were made as well. So with that regard as well is the timing in terms of implementing the recommendations. So they will continue into 24-25. The management response does show that we have made progress in achieving and delivering some of those recommendations, and we were doing that naturally as part of the way we're approaching work at the council. So again, I believe that provides you some assurance that between external audit and ourselves, we are working towards the same goal. And I will pause at that point and hand over to Laurelyn.
Thank you. Laurelyn, welcome.
Thank you. That was an excellent introduction, by the way. Stolen a lot of my thunder. So as Kirsty's just said, this is a report covering 2 financial years rather than the usual one, as part of our plan to get back onto a normal reporting cycle after the delays of the last couple of years. So it is relatively backward looking at this point in time because it covers the 2 financial years that ended 31st of March last year. And it covers 3 key areas that are set out in the Code of Practice under which we audit. So it covers the council's arrangements to secure financial sustainability, it covers the council's governance arrangements, and it covers the council's arrangements to secure economy, efficiency and effectiveness in its use of resources. It's a relatively positive report. I know there are a number of recommendations in there, but I thought it was worth putting some context around those. So there are different levels of recommendation that we can raise through the work that we do. So the lowest level recommendation in effect is an improvement recommendation. So that's where we're satisfied that the arrangements that are in place are appropriate and there are no sort of significant weaknesses within those arrangements, but there are ways that the council could improve upon the existing arrangements. The next level up would then be where we have identified a significant weakness. We raise a key recommendation, which is a recommendation that we consider key and should be acted on sort of with more urgency. And then if we were to find something even more significant than that, we'd be looking at potentially statutory recommendations, which you will have seen there have been a few in the last couple of years. So I just kind of wanted to put that kind of scene setting around the report, which, as I said, is a relatively positive report. There are a small number of improvement recommendations in there, and I'd like to thank the council's officers for engaging in the process, and the responses that we've had from Rutland have been really positive and really comprehensive. So I'm happy that the findings have been taken sort of appropriately seriously. I wasn't planning to talk through any of the report in detail, but I am happy to take any questions if anybody has any.
Thank you. Councillor Payne.
Thank you, Chair. I just want to get this on the record. The reason for this is basically because of COVID. We're trying to get ourselves back to where we would normally expect to be if we had not had so much disruption caused by COVID. Is that correct?
Largely, yes. So you will know there is a significant backlog across a lot of local authority accounts at the moment. This is definitely not something that is limited to Rutland. And it effectively was a bit of a perfect storm of factors, but COVID was the main one, and COVID was what kind of started the delays that we have experienced over the last couple of years. So it's not anything specific to Rutland County Council, and in fact we're reasonably far progressed with the 22-23 financial statements audit, so we are looking to be back onto that normal reporting cycle in the next month or so, which is a very positive thing in the current situation.
Carry on.
Yeah, I just wanted to get that clear, because obviously when you see something like 2 years of annual reports, it doesn't just happen. There has to be reasons, and I think for people who are listening in, to explain it in more layman's terms is probably good. What was the other major factor apart from COVID then that has caused the backlog?
So again, not necessarily Rutland specific, but across the whole sort of local government audit sector, there has also been a sort of a noticeable shortage in terms of audit staff and sort of qualified auditors, because the way that we audit in the local government sector is very specialist, and it's a specific skill set that not everybody has, and we are also noticing a lack of qualified sort of accountants within local government, within councils as well. So we've had a few years where capacity hasn't been where it ideally would have been within the audit firms. It's also not been where it would have ideally been within councils. And then you set that against the impact of COVID, and it's just been a bit of a perfect storm of different factors.
Thank you. Councillor Johnson would like to come in as well on that.
Just a point of information, I'd like to assure Councillor Payne, I went to the LGA Finance Conference in early January and then attended a webinar with various government departments, and it was evident I wasn't aware of the total extent of the lack of completeness of audits. I think the figure was quoted something like 420 audits were outstanding at 11th of January. And the national plan involving all the government agencies to bring it back together was to bring all the audits to completion by October 25. So that gives you an idea of the extent of the delays.
Well, thank you for that. I wasn't aware of that, I must admit, and clearly there has been a perfect storm. Let's hope we can go over it then. Thank you.
Councillor Powell, then Councillor West.
Yeah, just to follow on from that sort of questioning from Councillor Payne then. So, and I see from the response to the improvement recommendations about the capacity at Rutland that a lot of that has been addressed. So I think that's to be congratulated, and that's hopefully sorted, because again, if you don't have timely financial information, we're looking back 2 years. So how confident are we that going forward, these audits for this 23-24 and going forward will be able to be completed in a timely way?
So you might want to come in after I've done my bit. So in terms of the outstanding audits for Rutland, the audit of the 21-22 accounts is finished. That will be signed imminently. 22-23, we're hoping another week or two, and that will almost be complete. So that's the sort of the backlog for this council, which we're hoping to have cleared within the month, basically, which then means that come the summer, the 23-24 audit can kind of go ahead as it normally would, with a view to sort of resetting that timetable. So we regionally at Grant Thornton within the Midlands, we are aiming to have all of our local government audits for 23-24, with a few notable exceptions, signed by the end of the calendar year. So we don't envisage being back in this situation next year.
Andrew, do you have anything to add to that?
Just that we've recently gone through a recruitment campaign in the finance team, so we were running low numbers and on interim staff as well. We've now changed our structure in finance, so there's 2 deputy heads of finance beneath me, which helps in terms of strategic capacity to deal on more technical issues of the accounts. And we've recently been fully staffed for the first time in a number of years. So again, we are back up to speed, and that ties in with how we've been able to help work with Grant Thornton to clear the backlog. So we're in a much better position to deal with the audit for 23-24 and get back into a normal cycle for finance as well, because going through audit in March is not good for auditors, and it's not good for us when we're trying to prep for 23-24 closure as well. So we're hoping to be back onto normal cycles as well for next year.
Kirsty, thank you.
Thank you, Chair. And also in terms of that strategic level response as well, there is a recognition within the system because of the state that things need to be done differently. So we very much are put under a private sector microscope in that, for example, when the auditors audit our balance sheet, they're looking at the value of our assets, and there's a lot of rigour, rightly. But I would recommend, and it's been suggested, you know, is it proportionate? So the amount of time we spent valuing roads, for example, our valuers, so our third-party experts and Grant Thornton's third-party experts, is that adding value? And when you look at the local government as a sector, is that adding value in terms of going concern principles? So that has been recognised. Pensions is another area as well, where they're looking to look at our disclosure and therefore the workloads involved as well. So there is some movement nationally in terms of adding value in terms of local government. What's key drivers for us as well.
Thank you. Councillor Powell, is there anything else to add? No. Councillor West, please.
Thanks, Chairman. Andrew, you've answered most of my question, I think. I was just going to mention that in our report 323, we've got low risks, but we can't implement anything. Weighed against £1 million of unplanned savings from unplanned vacancies, and I just wanted to make sure that we were in a position to, you know, is that really a low risk for us, or are we sufficiently staffed to be able to implement things that we need to? So yeah, my question was really, you know, is the risk really only low to us? But I think Andrew's just answered that and said, well, actually, the finance team are back up to full strength now, which is nice. But I did note Penny's report. I haven't read it. Well, I've read it, but I'm not entirely sure I've taken it all in. There just seemed to be a lot of red in it. Vacancies. So that was just the vacancies there jarred against the, you know, our evaluation of risks. Risk 1 recommendations from reports are not able to be implemented in a timely manner. If we haven't got the people to do it, we can't do it. So is the risk therefore really low?
Kirsty, thanks.
Thank you, Chair. It's the implementation of the recommendations as per Grant Thornton's. As you'll have seen in my management responses back, they have been implemented to some degree. There's always, you know, I'm a big subscriber in terms of continuous improvement. So absolutely we can. There's a recommendation for benchmarking, for example. So we've made those initial steps, as you'll have seen in the medium-term financial strategy. Can we do more? Absolutely. We can look at our service provision as well, not just financial ones as well. So that's like the next step on. So that's why that's low in terms of we've made some of those positive steps, I would argue. But absolutely, in terms of capacity, it is a strategic risk, as you're aware. Laurelin's alluded to, and Andrew to some degree, accountants, especially public sector ones, are in short supply as well. So, indeed, there is a recommendation in there about workforce strategy. So we need to be taking that longer term view, and I'm looking at Andrew, but we do talk about, growing our own, in terms of mitigating that risk, but it's not an immediate fix. But I think as a sector as a whole, there is investment and thought that is required in terms of that workforce strategy as a whole as well to mitigate those risks, like you say.
Thank you. Any more from the committee? I've got a couple of questions. I was pleased to see, one observation first, that despite the protracted timeline, there doesn't appear to be an increase in budget or cost, sorry. Is that right?
So
that's a no then.
So I never like to give a completely final answer to this question until we get to the end of the process. But I think for 22-23, I think there have been some delays to the audit process that probably will have caused an increase to the fee. I'm not anticipating it being significant on what was kind of in our initial audit plans, because for the most part, it has been a case of delays to the process rather than the process taking longer, if that makes sense.
Makes sense. When do we actually find out the impact?
So we will be looking to report the 22-23 audit findings to the next committee, and the audit fee will be within that report.
Okay, thank you. The other question I've got is probably for Kirsty and Andrew. Could you please advise how the recommendations in the report will be implemented and followed up, of what the management control will be over those? Because it's obviously quite critical that we do improve from this point forward. I know there are management comments, but it's how they will actually be implemented and tracked.
Thank you, Chair. Yes, so to some degree, some have been implemented already. With regards to the workforce strategy, we have a new head of HR and organisational development, and that is very key on her objectives in terms of delivering that workforce strategy. So we're working on timescales in terms of the summer, late summer, early autumn, in terms of a first draft version. So you can imagine she's got to get an overview of the organisation and see where there are opportunities as well as our weaknesses. There are some, I think there's a recommendation in terms of how our strategic risks are reported through to Cabinet, which again, this audit committee has already recognised and is in train. I'm trying to remember them. And with regards to the sustainability, we've implemented a new medium-term financial strategy, an integrated budget plan. You've seen that at February in terms of the transparency within the documents, the reserve strategy. So there are key points that I would argue that have been completed as well. So in terms of those ones that still require some work, or we can still make some improvements, that will be part of the service planning, for example, of the services. So I'm looking to Andrew there. We build in, traditionally we would build in audit recommendations as part of that service plan.
Okay, that's good. Linked to service plan was what I was after, is pretty key. So it's embedded in your daily lives. Yeah, thank you. And then the other thing was I was quite indignant about the comment on the on the risk and the risk register and the Audit and Risk Committee, because it has been reviewed regularly in this committee in line in 6 monthly periods whilst I've been chair anyway. So, yeah, okay, thank you.
If I may, Chairman, I've drafted email back to you. I think you're absolutely right in that regard. So this again, this reflects some of the fact that it's referenced in 21, 22 and 22, 23. So the historic nature of it, as like you said, it certainly has come as a regular basis to this committee.
Right, thank you. I haven't got any more from the committee? No. Please could I have a proposer and a seconder to approve? Councillor Payne and Councillor Powell. Thank you. All those in favour?
Thank you. That's unanimous, Chair.
Thank you. So item 13 on the agenda is the RIPA update from Kirsty. Thank you.
Yes, and there is no update in that it has not been applied. We have not used the RIPA powers.
Thank you. That's good. Item 14, any other urgent business? I haven't been notified of any, so that just allows me to advise of the date of the next meeting, which is provisional because of the annual council meeting, which is Tuesday the 25th of June 24. And I close the meeting at 8:02, and thank you very much for your attendance. Thank you.